So our first presenter this morning is Farah Magrabi. Farah is an associate professor at the Centre of Health Informatics within the Australian Institute of Health Innovation at Macquarie University. Her presentation is titled Securing Our Health Information from Cyber Threats as the World Goes Viral. Please welcome Farah.
Thanks, Brendan. Good morning, everyone. Indeed, it's lovely to be here and to be giving this talk today, and I thank the organizers for inviting me. So as the title suggests, we're going to talk about cyber risks in health. We'll do this in 3 parts. In the first part, what I want to do is to just lay some fundamentals, look at how information technology is used in healthcare, and then also at some trends in terms of where it's going. We'll then look at the consequences of cyber risks. And the final part, we'll look at the socio-technical considerations. So what are the important things, or how do you get security to work in health? And what I'm going to do is to share with you some of my experiences of working in patient safety, because all of the things that we're talking about in security, they also have kind of parallels in terms of how do you make IT systems safe in healthcare. And so I'm going to draw upon a lot of my experiences in patient safety to kind of address the security question. So let's get going. In a very, very sort of fundamental sense, digital health can improve care delivery and patient safety. We're seeing that IT systems are revolutionizing healthcare. IT is also becoming a key enabler for patients to actively participate in their care processes. Indeed, I'm sure there's many IT-savvy folks in this audience who are tracking every activity, accessing their health information, communicating with their providers. It'd be interesting to kind of find out a little bit more as we go through. IT has many, many benefits in healthcare, but just like any other sector, we're susceptible to these risks of cyber threats. Where the use of digital technologies basically makes us vulnerable to cyber threats. What is IT used for in health? And this is really important to understand as we try to address the security questions. So what information is really being used for in health is it's being used to make decisions. We're making decisions every day about diagnosis, about treating patients, about prescribing, about retrieving health information, providing clinicians with alerts and reminders. Health information needs to be communicated. So across the board, we're looking at everything from email to really specific communication, like the ordering of pathology tests, referrals. I'm sure everyone has visited a GP in this audience and then gone off with a letter to go see a specialist or go see, any other healthcare provider. And now with electronic systems, all of those referrals will increasingly happen online. And so that was messaging. And then we need to keep records. So, we're moving from keeping records on paper to maintaining them electronically. And we're sort of doing that right across the board. So from GPs and primary care clinics to hospitals. And as I mentioned to you, increasingly consumers are being more engaged in their health and also in maintaining their own health information. And we'll come back to that in about 2 slides. Health processes are being automated. So the example here is pathology testing. There are many tasks in this process. A test needs to be ordered, the specimen needs to be collected. The results need to be made available so that once the specimen is processed, and then the results need to be sent back to the doctor and made available so they get read in a timely manner. All of these tasks, when you digitize or you automate a healthcare process, are then being supported by IT systems. Similarly, for other processes such as medications, you have the prescribing of the medications. The medication then needs to be checked and dispensed, and then given to the patient. So what we're finding is increasingly IT systems are supporting important clinical processes in hospitals, and in general practice. And what we would say is that they are now playing a mission critical role. So it's not just, at the end of the day, you're using IT systems to bill patients or, to maintain or order, things that you might need to keep the hospital up and running, but you're actually using IT systems 24/7 to support the delivery of care. And that's why, as we'll see when we go through this presentation, it's critical, or it's actually significant when these IT systems are taken down by a hack. The information for many of these processes is also provided by medical devices, which are increasingly being networked. So in the old days, you'd have, the ECG being acquired and then that information manually being put into an electronic system. But increasingly, medical devices are networked. And that, again, increases another potential, source to get into or to hack a system. Overall trends in Australia. So we're doing pretty well. Overall, 97% of our GPs use electronic records in hospitals, and I have the numbers here from New South Wales, and I'm pretty sure it's similar up here in Queensland, where in 2014, 80% of New South Wales, or the care delivery to 80% of patients, was supported by electronic records. Nationally, we have the My Health Record system, which has about 2.7 million consumers enrolled at the moment. And that's only going to increase. The system has moved from an opt-in to an opt-out model. So if the current trials are successful, then it'll move to an opt-out model. So many more people being enrolled. So that's kind of, so we're seeing consumers are being more and more engaged with their health. So here is a patient portal. It's basically the patient-facing information system that is being provided by a hospital. And I had to pick a US example because there's not that many in Australia yet, but we're sort of moving in that direction. What these systems allow patients to do is they allow them to view their own records, to look at their test results, to look at their current medications, to keep notes, to communicate with providers, and also keep an eye on the records of their family or the people that they care for. We're tracking our activity a lot more. So how many people in this audience are tracking their activity? Fitbits, there you go, few, probably many more than who are willing to admit. And then we're sharing all of that information in social media as well. So at that point, what I want to sort of do is just kind of pause for a second. And what I've tried to show you in this first part is to show you that health information is distributed. And the power of health information then really comes from, making that information available, or making that information which is distributed across many sources. And what we want to do is to join the dots from a variety of sources. And so the effective coordination of care then relies on communication of that information. And that's just not any information, it's confidential information. It's your confidential information, it's my confidential information. And so we need to be treating that very, very seriously. If we take the example of a very common disease such as diabetes, I mean, most of the people in this audience are probably young and healthy, but if I had to pick an example where you have a multiple number of people caring for a patient. So diabetes is a very common disease. You can see that there are many players, or there are many people on that team. So you have a GP, a specialist, a dietitian. Indeed, a significant portion of that information is sitting with the patient in terms of what they are eating and how active they are being to manage that disease. And in a sense, there's no point in having all of those information if you're going to lock it down. So what we know, a very fundamental sort of principle, is that there is a tension between access to health information and security, because having health information in health is all about making it accessible, making it available to clinicians at the point of care, and to allow them to join the dots from a variety of sources. And that's a really tough thing when it comes to security, as this audience will kind of appreciate. And where is it going? So here is a slide of the digital health revolution. So I was looking for a picture that would capture everything, and this kind of does it. It's not great resolution, but I'll try and talk you through it. So what we're seeing now is, with the digitization of health care. We're combining the digital revolution with the genomic revolution. And what this is doing is it's providing much, much more data than that there was ever available, and we're getting it from many, many different sources. So right across the board, we're looking from wireless sensors and devices to mobile devices, social networking, genomics, the internet, imaging, data, and then health information systems, which is what I've been talking about mostly. We're moving from treating diseases to actually prevention. So we're moving from general treatments to tailoring treatment to individual patients. And you can't tailor a treatment to an individual unless you have all of their information and then that's processed in a correct manner, because you're really relying on that information to make the right decisions. And so last year, the US President Obama announced the Precision Medicine Initiative, which is essentially what trying to do is to bring together information from a variety of sources, many, many, many more sources than we can ever think of, to tailor treatments to individuals. And that's pretty much where it's heading in health. We're only going to increase the amount of data. So big data is a cliche word, but in health, the amount of data that we have or the amount of information that is going to be made available about patients is going to increase. And we're looking right from birth to death. It's not episodic care, but really caring for people on an everyday basis, and then consumers increasingly being more active participants in their health. So then they need to be accessing all of their data as well. Against that background, we see that cyber risks in health are on the rise. If you've even been without even really paying, a lot of attention, if you've been following, the news the last couple of months, so ever since I got invited, I've been keeping an eye out for cybersecurity stories, and most of them tend to come from health. It's very interesting. So in the US, hacking healthcare records has reached epidemic proportions in 2016. So in 2016 alone, 3.5 million patient records had been compromised. You're looking at about, on an average, 4 data breaches per week. A survey of US healthcare organizations reported that, 89% of organizations reported one or more data breaches in the last 2 years. In the US, again, the cybersecurity market is estimated to be about 75 billion and expected to reach 170 billion in 2020. So, you guys are in the right business in some ways. So let's now kind of look at, what are some of the consequences. And it's important to understand these consequences as we start to, look at how we can address this important security question. So at a very basic level, just like any other sector, privacy breach is common. But what's different in health organizations and what makes them particularly susceptible is the volume as well as the variety of data that they store and collect. The scale of data breaches is particularly notable. So the Anthem, so just go back a second there. In 2015, you had about 1 in 3 Americans who were victims of their health data being breached. 1 in 3. That's pretty significant, I would say. These were attributed to a series of large-scale attacks. So this was not like 1 or 2 people's records being breached, but large-scale attacks that each affected more than 10 million individuals. The attack on the insurance provider Anthem was reported to affect the personal records of 79 million people. So there was a single attack, 79 million records being affected. And here are some data. So this all gets reported in the US. So the US Department of Health and Human Services requires the reporting of data breaches affecting 500 or more individuals. And they started tracking this back in 2009. So the horizontal axis is the years, and the vertical axis is individual records being affected, millions of records in this case. And in 2015, it was 113 million. And so it'll be interesting to see what it is for 2016. Turns out, identity theft and fraud is common. So as with most other, information that is hacked, but your medical record is worth much, much more to hackers than even your credit card records. Anyone want to have a guess at how much more?
100 times.
Too much. Lower? 10. it's about 10 times more than your credit card information. And there's a huge underground market for stolen patient data. What hackers or what fraudsters tend to do is they tend to use this fake identity information to then buy medical equipment or buy drugs and then sell them. The other way is to combine patient information with provider information. And this has actually happened in Australia as well, where the records of some patients attending a general practice were hacked, and then that was combined with the practice information to commit a Medicare fraud. So basically send lots of claims to Medicare, but the claims are being routed to the hackers, not the practice, and there was no medical service being provided. One of the problems is that these kind of breaches take much longer to detect compared to a credit card. So once a credit card a fraud is detected, or as soon as you lose the credit card, you ring the bank and cancel it. But when a medical identity theft happens, it takes much longer to detect. It's only, a few months later when a patient receives a huge bill, and this is the case in the US where, patients are suddenly receiving huge bills for services and surgeries they've never had. And then you're thinking, well, where's this coming from? And then so they've gone to look, and that's where they found that the identities of these patients were stolen and then being used to make false claims for payments. We're seeing similar trends in consumer technologies as well. Earlier this year, the online accounts of Fitbit users were hacked by fraudsters who changed their usernames and email addresses. They then used that information to order replacement parts under that user's warranty. And they also got access to the user's GPS history. So basically their activity levels, when they were sleeping, when they were waking, and that could be used to commit other crimes. Ransomware has emerged as a major threat in the last couple of years. And these attacks have targeted all kinds of healthcare organizations. So from a small general practice to large hospital networks. And I'm going to show you a few examples. So one such attack occurred right here on the Gold Coast in Queensland. In 2012. So what these hackers did was they used the Windows remote desktop connection to get into the practice records, encrypt all of the data files, and basically lock it down. And they demanded a ransom of about $4,000. So the good thing was that this practice had been backing up all of their data. They didn't have an image of the system. So as soon as it was detected because they tried to log in, and then there was a message from the hackers basically saying your data is locked up, so pay up, and unless you pay up, we won't unlock it. And so because they had a full data backup, they were able to restore it, but it took a couple of days. So meanwhile, the practice staff had reverted to paper records to make appointments and to also keep patient records. Earlier this year, a hospital in the US, so this was the Hollywood Presbyterian Hospital, lost access to all of their email and their electronic health records. So if you think back, and this was for more than a week, and if you think back to the first part of the presentation, I said these IT systems are supporting critical patient care or critical delivery of services in a hospital. And if you've taken these systems down, so email and electronic records, you're basically paralyzing doctors. How are they supposed to make any decisions about treatment of patients without accessing records? On a much larger scale, and this involved 10 hospitals, 250 outpatient clinics in the Washington, D.C., Baltimore area. Again, this was in March this year, and this was the MedStar Health Network. So it employs around 30,000 people, treats thousands of patients in that area. The entire system was forced to shut down for a number of days. Clinicians had to resort to using paper records. They had to, bring out the fax machines and their pages to communicate. It took about a week to restore systems, because what they basically did is they took everything down and then maybe restored it from the backup. So they weren't willing to publicly discuss the nature of the attack and how they brought systems back up and running, because they didn't want to give publicity to the hackers. But no ransom was paid, although there was a demand for a huge ransom. The Los Angeles hospital, in contrast, ended up paying a ransom of about $17,000 in bitcoins. And as this audience is familiar, that is much, much harder to track. So increasingly, the use of bitcoins makes it, more, I guess, easy and to get the payment, so much more easy to target healthcare and other organizations as well. Turns out that hackers can have other motivations as well. So health organizations can be targeted for a politically or socially motivated purpose. So this was the very first instance of hacktivism where a healthcare organization was targeted. This was the Boston Children's Hospital back in 2014. And what the hackers did in this case, so there was a child custody case. It was a highly publicized child custody case and the child had been treated at this hospital. And so what the hackers did is they directed a distributed denial of service attack against this hospital's external website. So not the internal systems, but the external website. In addition, they made multiple attempts to penetrate the hospital's network via exposed ports and services as well. They sent a lot of spear phishing emails to again get into the network. And rather than making, the clinical applications completely available, because the network traffic was just being flooded, it rendered certain applications or certain functionalities of applications unavailable. For instance, clinicians could prescribe or write up prescriptions and print them, but they couldn't send them to the pharmacy. The email, so to kind of restore systems, they had to shut the email down, find the malicious email, and then notify staff not to click on any email. They had to develop workarounds for any processes or internal processes that relied on the network for communication. And the irony was, when this attack happened, the child wasn't even at the hospital. Their child had already left the hospital. So here's a graph of the actual attack. So you can see that the blue bit is legitimate traffic, and then the red bit is as the kind of attack progressed. It was basically the hospital worked with a defense vendor to redirect traffic. So this was all of the malicious traffic in red. So alongside disruptions to care deliveries, there's also the potential to directly harm patients. There haven't been any reports, thankfully, but the potential for such attacks has been demonstrated in research exercises. And maybe some people in the audience are already familiar with these because they've happened at conferences like this. So this was a security researcher who basically demonstrated that he could scan the network for insulin pumps that had a wireless connection. And then he could program them from his laptop to basically dump the contents of the whole device. So basically overdose the patient without even without any need for even the identification numbers. At a different conference, this same researcher showed that he could reverse engineer a pacemaker to basically deliver a high voltage shock from about 50 feet away. So medical devices, there's a high risk again there when medical devices are networked. And one of the big problems is that these types of attacks can go undetected. So once it's happened and nobody suspects that it could be an attack like this, and the other problem is also in investigating such events. So the other, if anyone's interested, I'd encourage you to go and look at this example I'm going to talk about. So this was a research done by independent security evaluators. They looked at a number of healthcare facilities and data facilities, medical devices, as well as web applications. So across the board in health, they looked at all of the possible ways in which healthcare information systems and devices could be hacked. And the premise of their sort of framework that they have developed is basically that when information is wrong, missing, delayed, or incomplete, it can harm patients. And so any cyber attack which has a potential to make information or to has a potential to sort of lost my words here. Any sort of cyber attack which has a potential to corrupt the information or patient information then can potentially harm patients. So that was patient harm, and those are kind of the main sort of consequences that I wanted to sort of just highlight to you today. So how do we kind of solve this problem? So you guys are the experts, and what I thought was worth discussing today was some of the socio-technical considerations for securing health information. And by this, it's about the people, it's about the tech and the processes within which they work. And then we need to, and also understand, what are the types of technologies, and that's what I'll talk about in the next couple slides. So when we think about people, you've seen, through this talk that there are multiple stakeholders for health information, and they're distributed in time as well as space. So it's really hard to define who needs access to this information. It really depends on how you progress in health, what you fall ill with, what are the side effects, and who else needs to be on the team, and how long that episode of treatment lasts. So there's multiple stakeholders in space and time. You go right from patients and carers to healthcare workers, social workers who need access to health information. The needs of these users are diverse, as well as their task requirements. So clinicians, their motivation is to treat patients, and you need to make that information easily available, otherwise a clinician will not use the system. We did some research about 2 years ago, and we were trying to find the most common reason why clinicians or consumers might call an IT help desk. Any guesses? Forgotten passwords. Forgotten passwords are the most common reason why users of health IT systems call a help desk. There might also be instances where a single password is being used by multiple people. The other thing is that the access to data is affected by people as well as other tasks that are happening. So a GP, for instance, is multitasking all of the time. They need to access sometimes more than one patient's record. They're interrupted, they fail to log off. And failing to log off is a very common problem in hospitals as well, as is sharing of passwords. It's not that, I guess healthcare workers or clinicians don't care about security. It's just that their motivation is to treat patients. And there's no malicious intent there, but they just forget. And that's, being part of human. The next thing is processes. So, there is a high availability requirement for data. Delayed access or no access can present risks to patient safety. The data access must not impede clinical workflow. So if you have multiple steps to log into a system, a clinician might not use it. And the reason why we're putting all of these IT systems in is we want clinicians to use it. And adoption is a huge issue. And once you get people to use it, but then if you block them by excessive security protocols, then it's not going to work. For example, a dual factor authentication, which is, might be traditionally done, it might slow a doctor down who is treating a critically ill patient. And especially if they forget their password, it would slow them down significantly. The other thing is that all of these things are governed by organizational policies and procedures. So for example, if you have people being trained to use an IT system and you're covering all of the staff that are permanent in the hospital, but then sometimes those policies and procedures don't cover casual staff, and there's lots of casual staff in health. For anyone who's familiar with the sector. So you might have, a casual staff member who's not trained to use the system, not trained in the security procedures as well. And so even though there might be training, there might be no requirement on that casual staff to undertake the training. So there's gaps in policies and procedures that need to be looked at. When we look at the technology itself, I think, I've tried to kind of convey to you that clinicians are highly dependent on their records. And if they're electronic records, then they're highly dependent on their electronic records. The needs of consumers will increase with participation. So if, there's critical information like accessing, your medications information, and you need to know what dose to take at what time, and if you don't have that information in your head, then that's defined as then critical information. Internet connectivity is high. We've seen that everything in a hospital is could potentially be connected to the network, and we do need to connect it because we do need to share that information. at the same time, the resources for IT are limited. Recently, I only heard for the very first time that now the NHS in the UK or in England has finally, trying to match their IT budget compared to other sectors. So 7 to 8% of the healthcare budget is now being spent on IT, and that doesn't happen in health as a matter of course. It's much, much less than that. If you're looking at retail and banking, that's a completely different, huge disparity in what we would put to securing or to IT budget. And security, so the other thing is that IT systems are not that mature. So if you compare, if you go and look at any of the user interfaces of these systems, as well as what's happening in the background, they're not mature at all compared to other sectors. So by definition, because we don't have enough resources being put in, the systems are not mature enough. And security, sadly, is not a priority in system design, implementation, and use. So we know that security cannot be a bolt-on at the end. It needs to be part of the design, implementation, and use. So there's more effort needed to try to integrate security into these processes. So what I've tried to kind of give you a flavor, and just to summarize and conclude now, is that digital health has many benefits. There's a tremendous potential, and we need IT systems to address major problems that the healthcare system is facing. There's no turning back from implementing these IT systems. So what I'm trying to sort of say here is that we're not going to. There's no question of going back. What we need to do is to sort of move forward and manage these cyber threats, as they do have a potential to disrupt care delivery and harm patients. I've tried to show you that IT operates in a socio-technical context, and security is actually a system property. It's not just about the technology, it's about the people, it's about the processes around that technology and what they're doing that makes it really important in terms of security. And a fundamental requirement is that security strategies should not impede clinical work or endanger patient safety. And therefore, management of cyber threats is really critical to digital health. Thanks very much for your attention. Questions? What do you think the main threat is? I think, sure, we don't have the potential for insurance fraud, but we're still, I think we're spending, still a lot of money in health, and we're still digitizing our systems. So the thing is, in actual fact, the healthcare systems or the healthcare IT systems in the US are a little bit behind Australia. We're very highly computerized. They've only started to catch up in the last couple of years, especially if you look at general practice. So I would say that although most of the stuff that I've talked about is about the US, it's just that there's much more reporting and there's much more information that can be found and presented. It doesn't mean that it's not happening here. It's just not being reported. Okay, so basically this is talking about the national My Health Record system. And so the access to My Health Record is via MyGov. And everything all the security requirements for MyGov apply to My Health Record. So basically, if you want to get into your My Health Record, you have to get in MyGov. And if you can't remember the complicated ID number and the 3 questions, then you're in trouble. Do you feel Australia needs to adopt something like? I think. Sorry, I'm just kind of like, this is new for me to read the question and answer, so. I think the answer to that is it's not so much about the HIPAA policy, it's not so much about the privacy protection we do need privacy protection here, and I think we do have enough of it, but it's more about reporting things, reporting data breaches. So I would say that, we do need to be reporting our data breaches and being more transparent about what's going on, because otherwise, if you don't know what the problem is, then how are you going to solve it? So it's not fairly new in health. As I've said, our GPs have been computerized for many, many years, and they're really at the forefront. In hospitals, it's sort of variable across the board. So some hospitals are highly, highly digitized. It's not new, and others are catching up. So it's kind of, and as I sort of, addressed in my talk, the budget for health IT is not that great. So when you have, there's no kind of gold plating here at all. You just, often there's not, once you've procured the technology, there's not enough to even implement the systems and to make them work. So we're talking about a highly under-resourced problem here. So as far as data classification, I'm not sure if I've really understood your question. So there are healthcare classifications, if that's what you're talking about, but I sort of have a feeling you're talking about some other kind of data classifications, as in the sensitivity of information. Is that?
Yeah. So when you've got like pieces of data, such as you might have something simple such as a patient's name and address. Okay, that's one sort of classification.
Yeah.
Then you've got the patient's name, address, medical conditions. They might individually be only a XYZ classification.
Yeah.
Together, do they compound into a higher level which has different setups of security applied? Or?
Yeah. So. I don't, the straight answer to that is I'm not sure, but I don't think it would be done at that level, because a lot of the systems that we're procuring are basically from vendors in the US. And unless that's been done, explicitly for an Australian setting, I don't think that happens in the background. There would be, access controls are kind of what you would hear being talked about. So who on the healthcare team needs to access what bits of information? And even that is kind of really hard. So what comes to mind is an IT safety event that we looked at, and this was in England, where a patient comes into an emergency room and gets treated, right? And they were HIV positive, and so basically their information, a test was ordered, and that the result of that test was not available to anybody else other than the ordering clinician. And what sadly happened was when that patient got readmitted to hospital, because they couldn't see that test result, they kept treating that patient, but they didn't have that critical piece of information. And unfortunately, that patient died of an infection. So they didn't know that they were HIV positive until that test came back. But that test didn't get read for a long time, and that patient was still being treated because they were now being treated by somebody else. So it's kind of, the information governance is not simple. Yep. I'm not sure about that. I can come back to you. Jeffrey? Oh, hi. So yes, there is a huge trend to move applications to the cloud. So I think one of the major vendors in general practice just this week announced, a cloud version of their system. We don't know whether it is increasing the risk of data loss because it's only now starting to happen. But I think for GPs, the cloud, as long as it's done right, in some ways, it could be the answer to many questions, because if you're talking about a GP who's sitting on their own in a practice, they don't have a lot of resources, or they don't have an IT person on site. There's usually, the contracting or that service is being provided by somebody else external so the backup and all of those things. If things are on the cloud, then all of that happens in the background without, the practice itself having to take care of it. Great. Thanks very much.
Thank you, Farah. On behalf of AusCERT, I'd like to present you this gift. Thank you for talking to us today.